I was going to ask my good friend, Dr. Pena, to comment on this. You know, a lot of this collaboration, in my opinion, depends on the leadership. And I know you are one of the leaders at your institution. So can you comment a little bit about the role of the leaders in trying to make sure that these collaborations do occur and not let one or two, let's call it bad apples, interfere with the progress of this kind of collaboration?
You know, it's funny because that was the same question I was going to ask Vic when I grabbed right at the end, because I think that's really the key here, right? And who has a seat at the table? Who's the people helping determine this strategic mission? And getting everyone's interests aligned, I think, is really the key here. You know, going back to answering your question, I think that it really starts with making sure everyone feels that they are a part of the mission. And I thought Vic's slide, you know, really laid out the mission. Hey, we have 3 things that we're striving for. I think, you know, that strategic plan, he showed the slide about a strategic plan 5 years out. I mean, that is incredible. To be able to sit with everyone in your vascular institute and have them decide and come up, you know, where you're going to put your efforts into is really the secret of moving things forward. If you don't have that vision, it doesn't get there. And to have that vision, you need to have everybody's interest and everyone feeling that they have a voice in making these decisions. And, you know, at our institution, I think some of the hardest decisions and the hardest processes involve, you know, we have a mix in terms of operators, in terms of where they come from. So the vascular surgeons and the interventional radiologists are part of a multi-specialty, really radiology type group. The cardiologists were recently employed by the hospital. The CT surgeons are employed by the hospital. And then trying to bring all those different interests together, trying to get to the common goal. And I think, you know, how do you manage those? You know, right now, the head of, you know, we have a management company. And really, the job of a management company is to look at quality. You know, we want to make sure the quality indicators and everyone knows what we're trying to get to. And then how do you use that along with the hospital to then sit and look for the future in terms of strategic plan? So, I mean, how do you avoid, like, going to your question, Mehdi, looking at making sure everyone's on the same page, is really trying to align everyone's interests and making sure everyone understands that the interests here are the most important. And I think that message of collaboration, I mean, both speakers really hit on that really well.
So I'll just answer one part of that question, which is how do you get folks aligned? And we don't do this enough, but we have retreats, and we had one a few years ago. We actually have one scheduled for about a month and a half, 2 months from now. And when we first started talking about, well, who should come to the retreat? Okay, we'll get, you know, the physicians together, et cetera, and then it expanded. Well, let's get all the APPs there, and then it expanded more. And the last discussion is invite everybody. Invite the secretaries, invite the nurses that help take care of your patients on the floor and in the operating room. And we're going to spend about 3 or 4 hours in either September or early October. We still are working on the venue and the logistics. And we're going to focus on about 3 or 4 big things. But the title of the meeting is a blue sky meeting, meaning what would you like to see? What would be the ideal world for the vascular center 5 years from now? And it's in some ways, some parts of it is brainstorming, but then you get eventually to a consensus over a couple of their areas that everybody is convinced is going to make us a better center, better for the patient, better for the providers, better for the institution.
Let me follow up with Dr. Sherlyn Sai. I know they work very collaboratively with Subhash and the group there at the VA. Sherlyn, any suggestions, recommendations as to how we can all work together in this multidisciplinary approach?
I actually think I think we are very lucky to have a great relationship between us in vascular surgery and the interventional cardiologists. I mean, Subhash and I are like, we either call each other or we're in each other's office almost every day. And I think that reflects a pretty good working relationship. And, you know, we trust each other. We think that we basically, think that each one of us will do, if I send him a patient, I don't tell him, well, I think you need to do this, this, and this. I'm like, this patient has a problem. He has a dead toe. Please fix it. And, I think whatever he ends up doing is going to be what's going to be best for the patient. And I think that kind of trust between each other is really important. We also, one of the cardiology fellows is in our clinic with us, so we try to sort of cross-train a little bit. I try to teach their interventional fellows how to do percutaneous access and per-close for the TAVRs. So, and I think I personally have learned more ways to get out of a problem minimally invasively than I had ever dreamed of just by hanging out with him. So I think we can definitely learn from each other.
Yeah, absolutely. No, I agree completely. And, the one comment I would make, since, we have worked hard, together with Heather to try to create the vascular center and to work together, I think the leadership is the key, in my opinion. That's why I asked the question. And because there is always going to be people that are going to feel threatened, all the things that Vic and Justin mentioned. And if the leaders show collegiality and collaboration, I think the other people will follow. And then the one other thing I would say is that it's like you've been in a relationship. If you walk in there with contempt, with offensiveness and defensiveness, it's not going to work. If you think you're better than them or they think they're better than you, that's not going to work. And everybody has to kind of drop those things at the door before they walk in. Any comments from Dr. Ramanan and or Dr. Mehta?
Tino, I have one question for you. So you described two groups that appear to be financially malaligned that are working together. So how do you get them to look at the future when the immediate maybe I'm losing money to send you a patient?
Yeah, I mean, I think that's the key of understanding that you're not losing money, you're growing the pie. You're growing that, the whole purpose of being collaborative is that at the end of the day, your patient's going to be treated better, you're going to have more patients, and by collaborating, you'll be able to, be functioning at a more efficient manner, be more effective, and at the end of the day, be, if you're looking at the finances, be better in your financial, state.
The one thing that I would say we did in our program is we started a multidisciplinary conference where we involve not only cardiology, vascular surgery, but also podiatry, and sometimes infectious disease will come over and attend it. And that helps us discuss every patient with different specialties, get their viewpoints, and see what we can do best for the patient, as well as it is educational for the residents and fellows.
But again, the finances isn't always the part of it, right? I mean, if you come to these, I'm part of the heart team, so sitting down at our valve conference, and a lot of the discussions are really, whether that patient should go to a percutaneous valve or an open valve, and there's a lot of different opinions in those discussions, and they're not financially driven. They may be driven by other things that you're talking about, ego, silos, this and that, but it's very interesting. And as our fields continue to evolve and iterate, I think those discussions and having everybody collaborating are going to be key to making sure we are still providing the best care.